would you know how to assess the victim? Would you take the proper steps and precautions to save this victim's life? Today, I'm going to be talking to you about the proper steps to perform adult CPR on a victim, which stands for cardiopulmonary resuscitation. And we're going to get right to it. You got your victim laying out on the floor. First thing you want to do is assess the scene, because you don't want to become the next victim. You assess the scene is safe. You try to talk to the victim. Are you okay? Can you hear me? Tap on the victim to make sure that they just, didn't just fall and that they are conscious. So tap the victim. Are you okay? Can you hear me? You get no response. If someone's with you, you tell them, call 911 to go get an AED. So you got to get right to it because this person's life is in your hands. First thing you want to start with is the compressions. You're going to take the palm of your hand, place it in the middle of the chest in between the nipples. And you're going to take the other hand and place it right on top of it, interlocking the fingers. You're going to put all your weight on your hands, lean over, and make sure that your arms are locked. And you're going to press downward and fast motions. I'm playing this music to let you know that the beats are 100, the rate is 100 beats per minute. And you're going to be doing it to the beat of the song. And you got to count out loud. And 1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, and 13, and 14, and 15, and 16, and 17, and 18, and 19, and 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After that, you got to go directly into your airway and the breathing. So to open somebody's airway, you place one hand on the forehead, you place the other 2 fingers underneath the chin, so it's in the head. Next, you're going to look, listen, and feel. You're going to see if the chest rises and falls, and you're going to feel breathing on your cheek. You don't see any of that, you give your 2 breaths. Now these breaths should be about a second per breath, and you're going to see if the chest rises and falls. Then you're going to go right back into your compressions.
Do it.
And 1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, and 13, and 14, and 15, and 16, and 17, and 18, and 19, and 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After that, you give 2 more breaths. You do this for about 5 cycles. And the ratio is 2 compressions. The ratio is 30 compressions for 2 breaths. Now after you've done 5 cycles, you have your helper who comes in with an AED, which stands for automated external defibrillator. Now this is self-proof, it's dummy-proof, and it tells you what to do. You have the pads. You want to place the pads on the victim, and it tells you where the pads go. So it's no room for error or mistakes.
Analyzing heart rhythm. Do not touch the patient.
Gotta stand clear.
Advised. Stand clear. Shock now. Press the red button now. Shock delivered. It is safe to touch the patient. Begin CPR.
Like I said, it'll tell you step by step what to do. You leave the pads on, and you start your compressions again. Now, CPR, it stands for the circulation, the airway, and the breathing. Just remember CAB. Remember these steps. You can save a victim's life. You can perform the proper steps and precautions on how to save somebody's life. If you were the victim, wouldn't you want someone to save you or to help you? Thank you for your time. How long was that?
It's probably going to be.
Yes.
Okay, so that's what this is. This is all about speech class. It's not the intricacies of the CPR, but what all the other stuff. But right off the bat, you're yelling. It seems like you're yelling at us, or I mean, I know you're trying to be aggressive and talk loud, but a lot of times it felt like you're projecting too much. It's just an aggressive, assertive. You knew what you were talking about up there, which you had a good rhythm. You knew exactly. You were prepared. You could definitely tell that. But what it was maybe you were pushing a little bit